I want to talk about something I hear from almost every new patient. Do I really need to come in 3 times a week? That seems like a lot. It's a fair question, and I want to give you a real, thorough answer because once you understand the biology behind it, 3 times a week doesn't just make sense, it becomes obviously necessary. So let's use a great analogy braces. When an orthodontist puts braces on your teeth, they're moving bones, just like we're moving vertebrae. Nobody questions why a teenager or anyone has to wear braces for 2 years. We all understand that teeth don't move overnight. They move through sustained, consistent pressure applied over time. The braces are working 24 hours a day, 7 days a week. We don't have the luxury of leaving an adjustment in place 24/7. Your body is dynamic. You're sleeping, you're sitting, you're lifting, compensating. So between your visits, the spine has a tendency to drift back towards its old, familiar, misaligned position. That's because the muscles and ligaments that support your spine, the soft tissues, have been holding things in an incorrect position for a long time. They have a memory. In science, this is called plastic deformation. So the tissue has been molded into a shape over time. Every adjustment you receive makes a neurological impression. It tells your brain, this is the correct position. But in the early stages of care, that impression fades relatively quickly because your muscles and soft tissues still remember the old position and keep trying to pull things back. Think about what happens when you start going to the gym. The first week you're sore, the second week a little less, and by week 3 or 4, your body starts to adapt. Your muscles begin to expect the work, and the soreness fades because your tissues are changing. But here's the key that adaptation only happens if you show up consistently. If you go to the gym 3 times a week in January and then disappear until March, you're basically starting over every time. You never get out of the soreness phase, you never build the strength, and the same principle governs spinal correction. 3 visits a week means we are consistently reinforcing that new position before your tissues have a chance to fully drift back. So each visit builds on the last. Week by week, your muscles, ligaments, and nervous system stop fighting the correction and start accepting it as their new normal. Just like a trained muscle stops fighting the exercise and starts growing stronger. The early phase of care is the most critical window. This is when we're doing the most significant work on your nervous system's muscle memory. Research in chiropractic and neurological science shows that the nervous system's ability to adapt to a new position, what we call neuroplasticity, is highest during this intensive early phase. So missing visits during this phase doesn't just slow progress by a little, it can significantly extend your overall healing time. So if you're having trouble scheduling, please tell us. We will work with you. I know it's a time investment, but think about it this way. A few months of 3 times a week care transitioning down to maintenance, that's a finite commitment. Not addressing your spine, that's a lifetime of escalating problems. You're doing the right thing. Keep showing up. If you have any questions between now and your next visit, our team is always just a call or text away. We've got your back every step of the way.